Dear friends and partners, thank you for joining us. I'm very proud to be here with you today for the introduction of our latest neurosurgical workflow solution. For the first time, we are launching a new offering completely digitally and directly from the heart of Zeiss here in Oberkochen, Germany. I'm thrilled that modern communications enable virtual events like this and allow us to stay in touch with you, even and especially in these very challenging times. At Zeiss, we believe innovation is in our DNA, and therefore, I think there could not be a more fitting place from which to host today's event than our Zeiss Museum. It is a place filled with innovation. Innovation that has shaped many aspects of our world over the course of our 170-year history. From our earliest microscopes that helped uncover many fascinating aspects of human cellular biology, to the first photographs taken of our Earth from space and of the Moon's surface, to the incredible wafer stepper lithography objectives with which the newest generation of iPhone processors are exclusively made. The innovations around us have truly made a profound impact. Most importantly, though, we strive to continue on this path, innovating and setting new standards in order to help you, our partners in medicine, treat patients every day. So it is my honor and privilege to introduce to you our newest medical innovation, a promising imaging and digital cloud workflow solution that aims to support surgeons and pathologists such as yourselves strive for a more efficient and effective tumor resection. Please allow me to present to you our solution for in vivo digital pathology consultation, the Zeiss CONVIVO suite.
Welcome to this virtual event from Zeiss. I will be your host today, guiding you through the activities of this session on Zeiss CONVIVO. Continuous innovation, setting new standards in a continual open dialogue with healthcare providers to reconsider the standard of care. This is what Zeiss strives for. Consider a tumor treatment today. Could you imagine working on a tumor case without light and magnification? Zeiss visualization systems have always been at the forefront when it came to delivering optimal images in operating microscopes. Zeiss later introduced intraoperative fluorescence, setting a second standard enabling advanced visualization. So it has been, and so it continues to be, all about seeing. Now, Zeiss is just about to set yet another standard in this field with the new in vivo pathology suite, CONVIVO. Zeiss is adding a completely new approach to intraoperative visualization. Surgeons are now able to appreciate the tissue microstructure during surgery, share images amongst cross-functional medical teams, and receive real-time feedback, making it all about checking tissue in situ. You'll have the opportunity to learn more about it in just a moment. Zeiss finally enables novel intraoperative radiotherapy treatment directly after tumor resection as the third part of the Zeiss tumor workflow. This is what see, check, and treat is all about. Now, please follow me to experience the new Zeiss CONVIVO suite in more detail. And by the way, make sure to post your questions in the chat window. Experienced experts will answer your questions live at the end of this introduction. But rest assured that all questions will be answered in a written reply later on. One of the big challenges in the removal of a brain tumor is balancing gross total resection while preserving eloquent areas. For this surgical challenge, real-time information about the tissue composition could be crucial. In this video, you will see how the in vivo pathology suite CONVIVO from Zeiss is used during tumor resection. So, as you were able to see, Zeiss CONVIVO allows real-time feedback on tissue microstructure through digital pathology consultation. The in vivo pathology suite consists of two major components, obviously one in the OR, the CONVIVO surgical workplace to acquire images, and one in the pathology department, the CONVIVO pathology workplace, to view them. With both systems communicating with each other, connectivity is the basis for this solution and a fundamental prerequisite. If this piqued your interest, let's have a look at a demonstration of how it works technically from a workflow perspective. Let's start with the Zeiss CONVIVO surgical workplace. And for this introduction, we have the responsible product expert from Zeiss, Dr. Karl Kübler. Hello.
Hello. I'm happy to provide a demonstration of our in vivo pathology suite, Zeiss CONVIVO. The surgical workplace utilizes confocal laser endomicroscopy technology based on a scanning mechanism miniaturized into the probe tip. This allows to seamlessly integrate imaging of cellular structures into the surgical workflow. The scanner probe is designed to allow direct and safe placement of the tip on the tissue. The resulting confocal image is created by scanning the field of interest with low-intensity light. By the way, we are speaking about a resolution that allows to image cellular structures. How is this possible? Prior to imaging, a fluorescent dye is injected intravenously at the appropriate moment, so that it disperses into the extracellular space in the region of the tumor. Point by point, the laser light scans through the tissue and excites the fluorescent signal of the dye. The lens system inside the scanner probe collects only the light from the selected focal plane. This way, cellular microstructure can be visualized and a digital image is created. The focus depth can be adjusted to a level of up to 200 microns inside the patient's tissue. This technology allows the acquisition of images from a virtually unlimited number of locations in the cytos without disrupting the tissue. When taking images, you can choose from a variety of different capture modes. These include series images to capture frames in a row, temporal information, or the C-stack to capture different focus depths of the tissue. You can also browse through recorded images and sort out those with low image quality with just one click, thanks to the AI-based quality filter. If you would like to start the live stream with your neuropathologist, simply press Start Consultation. A green bar will appear to confirm a connection. The in vivo pathology suite will transfer the digital image. With the Zeiss CONVIVO Pathology Workplace, cross-functional medical team members are able to immediately view the recorded images from their workplace. In other words, the Pathology Workplace allows remote access to in vivo images captured in the OR to support the neurosurgeon. In addition, the suite makes patient and case information available where needed. Also, the Pathology Workplace allows you to scroll back through the last 50 frames and review areas of interest. Relevant images can be saved as needed. With a connectivity solution that sets itself apart from conventional hardwired systems, all of these options are readily available to you, anytime, anywhere. Simply log into the Pathology Workplace with your Zeiss ID using the device of your choice. Simple and secure. Since the Zeiss CONVIVO Pathology Workplace is a web-based solution, there is no need for additional hard or software. So this was a quick introduction from my side. I'm looking forward to answering any questions you might have in the live chat after the presentation.
Thank you, Dr. Kubler, for this insightful demonstration. Just imagine the benefits for your surgical workflow. You might also ask yourself, what do neurosurgeons who have experienced the CONVIVO say about this technology? Let's listen to what Dr. Francesco Acerbi from the Besta Institute in Milan has to say about it.
At the moment, the exchange of information from the operative room to the anatomopathology is complicated because there are two different departments and the samples need to travel from one place to the other. So you need to wait until the sample is available for the pathologist to be analyzed, and then there is the analysis process, and then there is the response that need to come back to the OR. So it's a long process and it's a difficult process. The digital exchange of images through the CONVIVO system will be very important to simplify this process because there will be a direct exchange of information, very, very easy, very fast.
And now, I would like to hand it over to Frank Zeitzinger, Head of Visualization at Carl Zeiss Meditec, who will go through your questions together with experienced clinical experts. Dr. Spetzler, Emeritus President and CEO of Barrow Neurological Institute, has played a formative role in numerous advances in neurosurgery. His commitment to technical excellence, surgical innovation, and making the very best neurosurgical treatments available to patients drove the pivotal publication about the application of confocal endomicroscopy in neurosurgery in 2010. Dr. Mark Pruhl is the Director of Neurosurgery Research at the Barrow Neurological Institute. He's had the opportunity over many years to see a wide variety of technologies that come through his laboratory. Based on the imaging capabilities of confocal endomicroscopy, he ranks it as probably the most exciting technology that he has seen in his career. Dr. Eschbacher, neuropathologist at Barrow Neurological Institute, is one of the pioneers who started to explore the potential of confocal endomicroscopy for intraoperative tissue analysis in neurosurgery more than a decade ago. This experience makes her the leading expert in the reading and interpreting of confocal images. Professor Jürgen Schlegel has been heading the Institute of Neuropathology at the Technical University in Munich for more than 20 years. Early on, he drove the establishment of telepathology as a service for smaller neurosurgical institutions. One of his major research interests is the advancement of novel methods of neuropathology that provide high-resolution images at the cellular level, such as confocal fluorescence microscopy. If you would like to receive more information, please contact your local Zeiss sales representative or visit our website for more information. For example, case examples of histological examination based on H&E stained images versus confocal images. So, to conclude, thank you for spending some time with me. And now, enjoy the live expert panel where your questions will be answered.
Welcome to the question and answer session we have here with our esteemed panel of experts. Before I start out with the first question, we have to apologize. Dr. Eschbacher from the Barrow Neurological Institute unfortunately fell sick, so she can't be here for this part of the session. But in terms of a pathology and neuropathology input and a specialist, we have Professor Schlegel from Munich here on the team, so we're set up well to answer all your questions. With that being said, let me start out with the first question that comes from Dr. Ray. He asks, and let me address this maybe to Dr. Schlegel, how does one learn the image interpretation perspective? As to my knowledge, we have not been familiar with scanning images appearance, and what's the validation for this new concept?
Yeah, thank you very much for this question. And first of all, thank you very much for inviting me for this interesting session, and I hope I can answer these questions. So that's the question is absolutely correct. We are still in a learning phase where we have to learn more about the images we get from the CONVIVO system. And so this is there's a flanking scientific approach we follow, and at the moment in my lab, so we have seen a lot of these CONVIVO images, but at the moment we do the conventional diagnostics in parallel to the CONVIVO images, and so there are cases where it's pretty easy, since the pictures we get from the CONVIVO system look similar to what we expect from the conventional histopathology, or let's say at the end from the cryostat sections we perform for the intraoperative diagnostics. But we also see pictures that do not look like what we expect, and there we have to learn. On the other hand, we observe that there are several aspects we see with the CONVIVO system we haven't seen before in our histology stains, and this is pretty clear since we now have a picture of the tumor in situ, and that's different to what we saw before. We handle with all our techniques, we handle artifacts, since the tissue is cut out and it is frozen or formalin fixed, and therefore it's artificial. And that's a great chance, but it's correct, we have to learn, and we are not at the end absolutely familiar with what we see with the CONVIVO, but I'm pretty sure that over the time we will learn more and more and see the advantages of this intravitreal procedure of diagnostics.
Great. Thank you, Dr. Schlegel. Dr. Spätzle, maybe I can address the next question to you. The question asks, what is your take on the relevance of this new solution for neurosurgery, and in particular to neuro-oncology?
Thanks. I appreciate the question. I'd like to make one comment on the previous question too. We've been using this for quite a few years now, and I must say it's too bad Jenny Eschenbacher, our neuropathologist, is not on this forum. For by looking at the cases we have collected, it becomes more and more familiar and easier to distinguish the pathology. I would say the drawback of the pathology is that you're looking at very, very small specimens, and obviously the depth you achieve is very, very limited. But I would find it quite useful that when you think you have removed all of the tumor and you are in an area where you have specific concern, it is nice to know whether you're really dealing with what looks like normal neural tissue, which is easy to visualize, or whether you are looking at abnormal tissue, which you ought to remove.
Thank you, Dr. Spätzle. Dr. Prull, you've been working with the system also for some time. So the next question I'd like to pose to you, one of the users here asks, I'm interested if besides tumor resection, there are any other fields of application outside of neuro-oncology. Do you see any other tissue that could potentially be analyzed with this technology?
Yes, let me just comment on the last question too, because The gastroenterologists have been using this technology for a long time, much longer than we have. And they have forged through collecting many, many images that they then compare to their conventional histology. And so in many places around the world, this sort of technology is used to filter out patients with precancerous or cancerous lesions in the gut, and going straight forward to the area to biopsy with the fluorescence labeling. And so what they get, a huge number of images that they sift through immediately, and just by their experience of collecting these images, which is what we've got to do, is that's how they then have compared their fluorescent images to their conventional images, just by collecting a huge number of what is essentially an atlas of gastrointestinal images. So that is actually underway in several of the centers, for instance, our center, in collecting these images and to compare them directly to conventional histology by various means, by personal inspection, by algorithms that compare the two different types of images. So, and to just add on to what Dr. Spetzler said, I think that it also, the technology is very important because it can tell us where to stop. It can tell us where not to go. For instance, you could use this imaging on an eloquent area in the brain that is exposed in the craniotomy, and immediately before any surgery is done or anything, inspect that area to determine if there is abnormal pathology there, abnormal histological images that are coming up. So to the other question that was asked of me, have we looked at this in other realms of science? We have. So we've looked at it for blood flow in small vessels. We've looked at how thrombi start and how various obstructions and emboli form in vessels, and everything up from capillaries to relatively small arteries. And we've also looked at it in terms of labeling specific antibodies that are within the laser range of the instrument, so within the blue laser range. So those are areas that we've looked at. We've also looked at it in terms of combining it with other fluorescent dyes, for instance, NBDG or 5-ALA, and these sorts of components where we look at the tumor tissue plus the vascular tissue.
Thank you, Dr. Prohl. Then the next question really goes more on the side of the pathology end. So, Dr. Schlegel, maybe for you on neuropathology side, how did you gain experience in interpreting these confocal images, and do you have recommendations for new users on how to learn?
Yeah, I think that question has been answered in part before by me and by our two neurosurgical colleagues. Since we compared the CONVIVO images with what we saw with our conventional neuropathological stains. And it's absolutely correct. This is a kind of learning phase where you have to collect as much material as possible. And over a time, it's really, as Dr. Spetzler already mentioned, after a time, you become more and more familiar with the images presented by the CONVIVO system. at several sites, the colleagues are working on a kind of atlas, and this is the first point where you can compare the pictures in an atlas and to see what you expect. But at the end, you need this personal learning. You have to see these images, and that's not only true for CONVIVO, that's also true for conventional histopathology. You have to learn it by seeing, and over time you become more and more familiar, and that's also true for the CONVIVO system.
Makes sense. Thank you very much, Dr. Schlegel. Maybe as an add-on, let me revert also to Karl Krübler, the specialist at Zeiss. Karl, is there anything that Zeiss is offering along those lines to connect users with each other and share experiences?
Yes, thanks, Frank. Definitely, I mean, we can see from these questions that this is something that comes to the mind of new users immediately. How can I interpret this? How can I kind of get used to something that is so new to me, my team, and my workflow? And we thought about this quite a bit, and we offer two things. I mean, firstly, we have a early access package now for users who are interested in gaining access now to this technology. And in this package, we also include membership to expert moderated community where we share cases, and we want to provide a platform where new users and all users can exchange. And this community should be in a way that new users contribute also their cases and can learn from the rest of the users globally. So that's number one. And number two, we also came up with a dedicated learning path for new users, which includes application training, shadowing programs, and also workshops for both the surgeon and neuropathologist, so that we really hope to, bring new users up to speed, at least to a level where we're close to where we are now with more experienced people that have been using the system in the past.
Okay. Thank you, Karl. Maybe I'll stay with you for this next question from Dr. Ang from Manila. He's a pathologist. He says he's interested in doing clinical validation studies in parallel with current standard of pathology practice. Any recommendation what he should do or who he should contact?
Yeah, I think, as we heard, we are already quite, busy, let's say, collecting all this data. And right now we are focusing on markets in Europe and in the US. So we are also limited from a regulatory perspective. But as always, it makes sense to discuss these things. And I guess we should just, stay in touch, get in contact, and then discuss possibilities, how we can work something out, and how you could become, part at least of this early access program once the product is available in Manila as well.
Okay. Thank you, Karl. Maybe before I go into the next question, I should have said that early on in the Q&A session. For everybody who's on the Vimeo platform, you need to log in at least as a guest to post questions into the chat. So if you haven't done that, please log in as a guest, and then you can also participate in the chat function. With that being said, my next question goes to Dr. Spetzler. Dr. Spetzler, is this solution bringing the cross-functional team of surgeon and pathologist and neuropathologist closer together? And how can this be beneficial? Would love to hear your insights. We'll continue and try to get Dr. Spetzler back on the line. Then I'll switch over to Dr. Pruhl. Dr. Pruhl, what benefits do you see given that this is an in vivo visualization device?
Well, I think that it improves the rapidity that you can get an interpretation from the pathologist, and also directly for the neurosurgeon. The neurosurgeon will need to become familiar with these images as well. It's got to be a learning curve for that person, as Dr. Schlegel says, and as Dr. Spetzler says. Really, you get a feeling for these images the more you use them. So the benefit of the in vivo is that you get a maybe not a diagnosis, but you see what the tissue is. You get a histological, a histoarchitectural impression by a on the fly image that you get immediately, and so it speeds the surgery. You don't need to wait for a frozen section to come back in an area, as Dr. Spetzler says, where an invasive tumor such as a GBM or an astrocytoma may very much look like normal tissue, and so you don't want to go on, and so that halts the surgery in many respects. And so also in terms of speed, as you can get a pathology interpretation that could be from the pathologist no matter where they are. It can be ported to a cell phone, to an iPhone, and those images analyzed by the pathologist immediately. So I think it really improves the whole surgical pathology workflow as you scan these, as you learn to scan these areas with the probe.
Thank you. Dr. Schlegel, what you should like to add onto that? There's a question that relates to this somehow. How can that connection to the OR with a live image stream influence your way of working? I think Dr. Prull touched upon a few things already, but maybe if you can add your insights to that as well.
Yeah, I think definitely our kind of working changes just at the moment, and I want to corroborate what Dr. Prull just mentioned. So we are on the way to digitalize pathology, and so therefore the CONVIVO workflow fits very well in actual modern ways to reorganize the pathological organization and the surgical pathological cooperation. And please let me briefly mention, we just learned, and at that pretty moment we learned during this COVID, Corona time, we perform a congress digitally. So we learn more and more to work in a different way, to communicate in a different way. And this definitely changes the way we work, and I think it's absolutely necessary for pathology and neuropathology to go this digital way, since this is the way of the future.
Okay, thank you, Dr. Schlegel. Dr. Spetzler is back, I heard, so let me maybe address this question again to him that I posted earlier. Dr. Spetzler, is this solution bringing the cross-functional team of surgeon and pathologist closer together, and how can this be beneficial?
Well, I think the first thing we really have to look at is the workflow. And when you consider the fact that a frozen section in the best of times takes 20 minutes to 45 minutes, 50 minutes to get a result back, the fact that you can scan something, look at the monitor, have your neuropathologist look at the monitor at the same time is, to me, the greatest advantage, because it speeds up the operation. The longer an operation, the greater the risk of the operation. So anything that speeds it up is very important. The ability to communicate with your neuropathologist or other neuropathologists in an immediate fashion has an incredible advantage. So I think the more that we learn about this, the more that we can utilize the information we get, the more we do like face recognition, so where tumor patterns that are very obvious, become easy for anybody to learn and interpret. I think that is truly the future. It is digital, as was previously said.
Thank you for that, Dr. Spatzler. Maybe let me stay with you. I know you also have some insights into radiation therapy. This next question pertains to that, and we can certainly then shift to somebody else as well. But Dr. Ray is asking, how are we planning radiation doses in close proximity to the tumor bed? Is it again safe to radiate in situ, sort of? I don't know how if you can talk about that, Dr. Spitzer.
Yeah, I am not convinced that is the best way to go. But clearly, the advantages of in situ radiation is the fact that you're sparing all the normal tissues, and that the effectiveness of radiation is obviously has to do with the proximity to where it is produced. So the question to me is always, if you add in situ radiation to a tumor bed, what are you sparing and what are you hitting? Is it any different than if you take a surgical tool and just resect that tissue? But the advantage of having radiation not affect the normal tissues and the healing process is very attractive.
Okay, thank you. The next question comes from Dr. Ang again in Manila. I think, Dr. Schlegel, this is maybe targeted to you. Can the fluorescent tags be used to target analogous protein targeted by standard IHCs to differentiate tumor from normal tissue?
So I'm not pretty sure if I understood the question, but the question was if to target the protein molecules with that fluorescent dye. Yes. And this clearly is a possibility to further develop the technique. The problem is we need the allowance to work with these molecules, but this is clearly an advantage, and one could imagine the labeling of tumor-specific antibodies with fluorescent dyes, and therefore have a chance to distinguish on a single cell level between tumor cells and normal non-neoplastic cells.
Okay, thank you for that. The next question comes from Dr. Ray. Maybe Dr. Prohl, if you can speak to this. Dr. Ray is asking if confocal images are part of neuropathology training programs in the US and EU, and does the fluorescein dye that is used just prior to examination, is that proprietary, and what sort of cells does it bind to? And you also mentioned that there's two other dyes, I think neuronal and glial. Can you speak to that?
I probably cannot answer whether definitively whether the training for fluorescent images is a part of pathology or neuropathology training, residency training in the United States. I think it's going to be. There, as Dr. Schlegel has said, there have been conferences. Even our neuropathologist, Dr. Eschbacher, has been to teaching conferences and trainings where she has trained pathologists and residents on these images, and I have been to meetings where that has also occurred. That occurs very much in the gastrointestinal world of pathology, and I would expect that it will become a great part of neuropathology. So on the subject of fluorescein is not proprietary. It is an FDA-approved drug, has been for decades, and fluorescein does not necessarily label the cells. There are a few cells that get labeled by fluorescein. Those may be old cells. They may be tumor cells that are sort of falling apart, that are disintegrated, and those seem to get highlighted by the fluorescein. But for the most part, the fluorescein is extracellular. So what you look at is you look at an image against a lighter background of the extracellular fluorescein that has become extracellular because of the leaking and abnormal tumor blood vessels. And so you see that there's a kind of a silhouetted appearance, but you still see within that silhouetted appearance very good intrastructural or cytostructural components of cells, and you can make out the patterns of various tumors, as Dr. Spetzler has alluded to. With regard to the CONVIVO, the other two, I didn't quite understand you, Frank, when you said those other two, but the CONVIVO sees fluorescence in a blue laser range, so its effective nanometer excitation is about 488 nanometers, and so whatever you're going to see has to be seen within that laser range for fluorescence.
Okay, yeah, maybe Carl, if you can add to that from a technical perspective, I think maybe you can underscore what Dr. Prull has said in terms of the laser technology that's lying underneath.
Yeah, of course. So I think what Dr. Prull said is absolutely right. You know, whatever you can excite with a 488 nanometer blue laser, and then the dye needs to emit somewhere in the green or yellow range or in the red, that can be detected with the CONVIVO. Now, if you look at it again from a regulatory perspective, obviously this device has been tested together with fluorescein, and that's where we have also the market clearance. Everything beyond that can work from a technical perspective, but it's clearly, it's really basic research. And I guess we heard previously, and I think Professor Schlegel, you mentioned it, you need to think about, how to clear these labels first if you want to use them in vivo where the strength is of this device.
Great. Good. So then we have one more question here in the chat at this point in time. And I'd like to come back to Dr. Prull maybe, because you mentioned also that, the colleagues in gastroenterology have been using similar technology for quite some time. And the question here is, have false negative and false positive studies been done by the gastro colleagues using it for many years? And then is CONVIVO in use in neurosurgery, and what are the false positive and negative rates?
So CONVIVO has not, well, it's the moniker CONVIVO, I guess, has not been used in gastroenterology so much. Its previous iterations in terms of Optiscan is where the gastrointestinal applications have been done. So let me just also present to you a very interesting, because one of the neuropathologists in Manila asked about tagging, looking at antibodies. In Scotland, there is a center at the University of Edinburgh that has been very forward in trying to distinguish between lung problems that are not bacterial versus bacterial infections, and many of these treatments cannot be instituted right away. So they have been able to tag the fluorescein with a very small molecule that readily attaches to bacterial infections. And so they have been able to, with this sort of technology, sort out patients very quickly that have acute respiratory distress syndrome from very dangerous bacterial pneumonias. And they provide then the discriminant treatment to those patients using this technology to scan in the lungs. So that is very much similar to something that can be done in the brain, and that is being researched at several locations with specific tagging of tumor cells, which I would expect to see used with this machine in the not too distant future. I think that's really quite a step forward. And what was the other thing, Frank?
If there's in neurosurgery, if there's any studies that you're aware of that false positive and negative rates.
So we did a study that was several years ago, patients from Dr. Spetzler and several of the other neurosurgeons that were doing tumor work here at the Barrow. And we did a prospective study that looked at the ability of the CONVIVO images, of the Optiscan images at that time, so the near predecessor to the CONVIVO, and how that compared to frozen section and permanent histology. And it actually compared very favorably. In fact, it was better. It was speedier, as Dr. Spetzler has alluded to. An image within about 14 seconds was acquired that informed the neurosurgeon and the neuropathologist what to do and what the tissue component was. That is an amazing step forward within 14 seconds, and within 7 images. So when you use the machine, there may of course be motion artifacts, but within that first 7 images that the neurosurgeon was using, an informational image came back. So the machine acquires an image about every 1 or 2 seconds, depending on your resolution that you send it to. That's within 14 seconds. That is an incredible increase in speed versus waiting at the minimum 20 minutes for a frozen section to come back. As far as false positives and false negatives, they were directly comparable to frozen section and to permanent section, if not a little better.
Great, thank you for that, Carl. You mentioned this, and I think, Carl, this next question goes to you. You mentioned that in the previous video as well, that AI is now getting into this new technology. There's new technology that we can now how to deal with these digital images. There's a question from Dr. Ryan, and he's asking, are there any future projects in combination with the in vivo application using AI in the years to come?
Yes, exactly. I mean, as Professor Poole just mentioned, you're seeing, for example, when you use it in vivo, you're seeing a couple of artifacts because you're moving the probe and so forth. And you don't, these images then are sometimes useless. So what we have already established is a filter using artificial intelligence to recognize these images and just highlight it, so you're not looking at and wasting your time with these images. And of course, this is just the very first initial step. So clearly, with any type of digital imaging, AI, it makes sense to look into this direction. There have been initial work done both at BNI and also at the university in Mannheim in Germany, I'm aware of, but there are also from other areas of confocal endomicroscopy. I think in the oral region, there was also some work on artificial intelligence algorithms, and it has been shown that it can be applied very successfully. And the more data we collect, obviously, and the better we can interpret these images, and that ties back to the initial part of our discussion. How to interpret these images. First, we need to learn. That's where we are at kind of right now. Pathologists can label these images, and then they later on have a tool that helps them to be even faster than today. And that's really what I think, what this means, even if you have an artificial intelligence tool available, this I think, in my opinion, does not mean, and we can further discuss this in this group, does not mean that, we get rid of the neuropathologist. It's just because what we see and what was emphasized previously also is that this connection of the team that we're now creating is also an added value, and the artificial intelligence will just strengthen this and not disrupt that.
Mm-hmm. Okay, maybe Carl, let me stay with you because you probably have the best overview. There's a question from Venkat. He's asking a list of installations across the globe. It could be with or without the tumor workflow that Zeiss is offering.
Yeah, so we are working with quite a number of centers, a number around 10 globally. And what I said earlier, once you are interested in the product, once you want to become a customer, and also once you purchase this device in the early access package, you will become a member of this community, and we will definitely want to connect all of the sites, given that we are facing, that we're working with a very new technology. It's very important that all these users are connected.
Great, thank you very much. I think this concludes all the questions I at least see at the moment in the chat function. If there's nothing else, let me just look if there's anything else coming in. If not, then I would like to sincerely thank all of the panelists on behalf of Zeiss, Dr. Spätzle, Dr. Pruhl, Dr. Schlegel, and Karl for presenting and being available for this Q&A session. Also to the Barrow, for the long-term interaction with us on this new technology and how we bring that now to the market. I know, Dr. Schlegel, you're also very deeply involved with the European group, so thank you very much for your time and this collaboration. We'd also like to thank all the people on the computers out there in the world. I know this is a difficult situation we're all in, but I hope with this new technology we can stay in touch and still deliver interesting content to you that's interesting. If you have any additional questions coming up after this presentation, please contact your local Zeiss representatives. They will then forward the questions to Karl Kugler and his team, and they will get in contact with you. Obviously, the launch video that we have currently, that we have recorded for this session, will be made available to all of you. And now for all of those who still have maybe a minute or two left over in your busy schedules, there will be a short video about the tumor workflow that we just alluded to, that ties together the CONVIVO 900, the CONVIVO, and then the IntraBeam 600. So if you have some more minutes in your schedule, please stay tuned. Aside from that, we hope to stay in touch with you virtually or in persona, depending on how this entire situation develops going forward. But please rest assured that there will be more content coming from our end. There will be additional add-ons to this pathology solution from Zeiss in the fall. So we stay in touch, in contact with you from that perspective. Aside from that, I wish you all a great remainder of the day. Stay healthy and hope to see you soon. Thank you from Zeiss and Oberkochen. Bye-bye.